too much of anything can make you an addict. It's a cliche stage phrase that
Mhm.
people use. Certainly, although marijuana is largely considered lower end on the spectrum of substances, it can be problematic too.
And as far as alcohol goes, back to back, like you said, alcohol has been around for a lot longer. It's more socially accepted. What are you seeing in terms of coping right now through this whole pandemic with the added stress? What are you seeing with alcohol happening?
Yeah, the biggest thing with alcohol is I think it's just a matter of convenience. And so we, for the most part, I know we can leave the house, but for the most part, people are sheltering in place and they're staying at home. And so you haven't really gotten much vitamin D from the sun. Maybe you feel like you're somewhat overworked or underworked, one of the two, and dealing with just the stressors of COVID-19 and the changes that have taken place. Bottle of alcohol is right there on the cabinet, or beers are in the refrigerator. And so it's an easier sort of fast way of achieving a short-term sort of coping strategy. And then once again, alcohol is legal. And so as long as you're 21 years old, there's nothing wrong with having a beer. It's been legalized and so forth. But one would argue or could argue that when you wake up in the morning and you feel like you need a beer, or in the evening you need a beer or a mixed drink to calm yourself down, now we kind of arguably are dealing with someone who's using this coping strategy, which arguably is not going to be so positive in a way that might not help them long term.
And that's just simple and easy to understand. If so, for the viewing audience out there, if they are feeling like they need to have a beer or a drink or a glass of wine at the time of at a time of the day when it is the start of the day or the end of the day or in the middle of the day or more than
Anytime.
twice or three times a day, it's a problem.
It can certainly be a problem, and it's just important that we all take our own temperature in terms of if our
Okay.
behavior is increasing, right? So once again, it's not anything. Even if you do have a beer or a shot in the morning,
Hmm.
that alone doesn't necessarily mean that you have a problem, but it can be an indicator. And so if you're noticing that you're drinking at times in which it normally wouldn't be, you wouldn't normally drink, and the amount that you're drinking is increasing and you're neglecting your responsibilities. Maybe you have children and your children aren't getting their dinner at the regular time that they've been accustomed to. These are all things that kind of add up to a potential problem being there. And so it's just important that we all kind of take a look at what it is that we're doing. And then just to kind
Okay.
of use a phrase that we've used on this show a lot in the past, any disorder is a cluster of symptoms. So alcoholism, alcohol dependence, alcohol abuse, that's not just one symptom alone. It's a cluster of symptoms. And if interested, people can kind of do a quick Google search and find out what the diagnostic criteria is of alcohol abuse and alcohol dependence, and it'll tell you pretty easily kind of what you want to look out for.
Okay. And so those other resources for coping with alcohol or marijuana or other substance abuse, not like narcotics, and all of those resources I'll include at the end of the show. So to the audience, I want you guys to look for those resources as well. So let's get to the subject of therapy, whether it's for substance abuse or addiction or mental illness. Just how important is therapy for people, for those who have not considered therapy, who have considered it but didn't follow through for whatever reasons.
Mm-hmm.
Um, let's just talk about therapy and introduce the idea of therapy
Yeah,
for mental wellness and other problems.
certainly. Let me start with just the whole concept of um, therapy has been around for a long time, and there are lots of different types of therapies, and one therapist is not going to be the same as another therapist. There are unique differences from individual to individual But one of the common factors of an effective therapist is the ability to build rapport and the
Mhm.
ability to engage in what we call unconditional positive regard, where you feel like you are not being judged, you feel like you can disclose your deepest, darkest secrets, and that's not going to result in you feeling worse than you came in to begin with. So I just want to kind of start off with a couple of those concepts. But therapy is, of course, or psychotherapy is talk therapy. And talk therapy is used for um, mental illnesses and mental diagnoses. So whether it's depression, whether it's anxiety, whether it's bipolar disorder, schizophrenia, um, conversion disorder, any disorder you can think of, and then personality disorders, borderline personality disorder as well. Talk therapy is a form of treatment in which, through one-on-one, or it can be group, or it can be family therapy, you're meeting with a trained professional and with the goal of reducing symptoms. If I had to really broaden it, most of the treatment goals are to reduce the severity and frequency of an episode. So if you have depressive episodes in your life and periodically you feel yourself find yourself depressed, one of the broad categories of a treatment goal would be to reduce the frequency of those depressive episodes and then also to reduce the severity. So instead of you being at an 8 on a scale of 1 to 10, with 10 being highly severe, now we want to bring that down from an 8 to a 5 or a 4, right?
Mhm.
So if you're predisposed, whether it's through your own chemistry or your own life experiences, if you're predisposed to depression, there's not going to be much we can do to completely eliminate it out of your life. But if we can reduce that and make it tolerable, then that's an effective form of therapy there. Okay?
Psychotherapy.
Psychotherapy, there you go. And
Mhm.
of course, you have psychiatrists and nurse practitioners who prescribe medication for those same purposes. And there are certain presentations where it's pretty difficult to make much progress outside of a medication. So, for example, even
Mhm.
really severe presentations of depression, schizophrenia, some of the thought disorders, you need medication to kind of supplement things. And it's actually also well accepted that one of the best predictors of certain presentations of mental illness is the complement of both psychotherapy and medication together. Right now, there are many presentations like a situational sort of stress in your life. Maybe you have work-related stress. Maybe you have a recent relationship that has currently ended. Most people will agree that talk therapy alone is going to be effective in that. You don't necessarily need any form of medication for that.
And is that also that where counseling, just counseling comes in, and is that an extension of
Yeah,
psychotherapy?
yeah. Counseling and psychotherapy are two terms that are similar, but they of course have some differences. And let me just kind of give a brief general sort of difference. Psychotherapy tends to be like the more in-depth sort of looking at some of your family history and family dynamics, as
Mm.
well as kind of what might, on a deeper level, underneath the layers of the onion, may be contributing to your behavior patterns, right? And counseling can be a little bit more short term, a little bit more solution focused sort of work. So, for example, if you find yourself engaging in alcohol usage for whatever reason, it might counseling might be, well, let's look at other ways in which we can address the source of the stress and make sure that you understand that you do have other ways of dealing with it. And let's just kind of jump into those. The psychotherapy sort of model is going to be a little bit longer term of therapy, and it's going to involve a little bit more depth. Not sure I did much justice in describing that, but hopefully that makes some sense.
We hope you enjoyed this episode of the Bay Area Mental Health Hour. Please visit our YouTube channel today, subscribe, and click on the notifications bell so that you can receive updates on our latest episodes. This conversation on substance abuse and therapy will continue. If you or someone you know is in crisis, help is available at the Substance Abuse and Mental Illness Helpline at 1-800-950-6264 or call the National Suicide Prevention Lifeline at 1-800-273-8255. Your support makes it possible for us to produce content like this. Thank you.